Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is Anna Paniagua, RN, Clinical Program Coordinator at Roots Community Health Center. We are reporting from East Oakland for the week of October 26, 2020. As health professionals rooted in East Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make the choices that will keep you, your family, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Oakland and East Oakland in particular. Alameda County now has over 23,000 cases and there are 461 deaths. There are more than 9,000 cases in the city of Oakland alone. This represents about 40% of Alameda County's cases, even though Oakland only makes up a quarter of the county's population. The top 3 zip codes in the entire county, and there are over 50 zip codes in Alameda County, the top 3 zip codes in the entire county in terms of both case rates and positivity rates are 94601, 94603, and 94621. These are all in East Oakland. And when we add up the total cases for these 3 zip codes, it comes to 5,308 out of the 9,021 cases in all of Oakland. So these 3 zip codes, all in East Oakland, make up about 60% of Oakland's cases. So in Oakland, which has 29 zip codes, only 3 zip codes account for 60% of the cases, and all of these zip codes are here in East Oakland. As we have seen week after week now, these 3 zip codes continue to have case rates more than triple the county average. And as you can see here, positivity rates in these same 3 zip codes are also about triple at 12 to 14% compared to the county average, which continues coming down and is now at 3.9%. Now this map, which looks different than the other one, shows our East Oakland zip codes looking a pale blue color. This map is looking at testing rates. So what I want to draw your attention to here is that the same zip codes with the highest case rates and the highest positivity rates have some of the lowest testing rates. Now this is the opposite of what we want to see. If we have more positives, it means we need more tests so that we can stay ahead of the curve, identify cases, and slow the spread. We'd like to see this map look like the others where the zip codes with the highest cases also have the most tests. Saying this another way, imagine if we were testing in East Oakland at the same rate that we were testing in other areas of the county. More than likely, we would be diagnosing even more cases and reaching more people who've been exposed so that we could stop the spread that is occurring disproportionately in our community. Now I'd like to show you this example of a zip code with a very high testing rate. I'm purposely not going to talk about the darkest blue one here, the 94720, because that is UC Berkeley's zip code and they are an outlier, presumably due to testing their students on a regular basis. But I did want to hone in on a zip code that is still doing very well on testing, 94702, which is also located in Berkeley. And I wanted to compare that to the zip code with the highest positivity rate in the whole county, which is 94621 here in East Oakland. As you can see here, the 94702 in Berkeley is testing at almost 1.5 times the rate that we're testing in the 94621. While the case rate in the 94621 is more than 6 times the case rate of that in Berkeley. And looking at the positivity rate in the 94621 is about 10 times that of the 94702. We should be seeing higher testing rates in locations with higher positivity rates so that we can get ahead of the curve. What that means is that here in East Oakland, we are still under testing. Even though there are a number of testing events and testing site locations, including Roots testing site at 9925 International Boulevard. Now, with the availability of testing sites all over the county, there's absolutely no reason not to get tested. If you have symptoms, please get tested. If you think you've been exposed, please get tested. If you work in a high-risk environment, you work with members of the public, or you work with people who are likely to be positive, please get tested on a regular basis. The bottom line is the virus is hitting Oakland harder than other parts of Alameda County, and it is hitting East Oakland even harder. This is our reality, and now we must decide how we are going to respond to that reality. Hospitalization rates remain quite low, and this is a good thing. Because case rates are improving and positive tests are slowing down, we know that restrictions will also start to lift. And as we've seen in other parts of the country, with some of the highest single cases in a day having occurred within this past week, we know that opening leads to cases going up again. We don't want to experience the same thing here. So please be vigilant. Just because something is open does not make it safe. As we've said at each briefing, without a cure or vaccine, the best tools that we have are to mask, distance, test, isolate, and contact trace. Now that we're heading into flu and cold season, it is extremely important that you don't blow off symptoms that you have thinking it's just a cold or a flu. And with the poor air quality and with these high winds, don't blow off your symptoms as just allergies or irritation. Please get tested. It's simple, and it will put your mind at ease, and it will protect you and the people around you. If you have a sore throat, if you have a headache, these are all symptoms that we're seeing very frequently being the first symptoms of COVID-19. And definitely, if you lose taste or smell, this is a symptom that is rather unique to COVID-19, so please get tested. And now my co-host, Ana Paniagua, RN, Clinical Program Coordinator at Roots, will go into more detail about getting tested with symptoms and also about the flu and pneumonia.
Thank you, Dr. Abulada. Hello, everyone. My name is Ana Paniagua. I'm a registered nurse and Clinical Program Coordinator at Roots Community Health Center. As a nurse, I am responsible for performing COVID testing and providing basic education about the testing process and COVID itself. As Clinical Program Coordinator, I make sure that those who test positive for COVID-19 get notified in a timely manner and that our team of nurses provides needed education and information. One thing I hear a lot from people who tested positive is that they thought their symptoms were just a cold or allergies. And now they have COVID and may have spread it to their loved ones, friends, and coworkers. For example, a fellow came in to test after a week of having symptoms. He was having mild symptoms, sore throat, runny nose, nasal congestion, and figured it was just related to a common cold. He had already been working for a week with these symptoms before testing. Upon testing, we advised him of the need to isolate, and we gave him instructions in writing as well. He tested positive, and after testing positive, he had already traveled in a car with his coworkers who later also tested positive. I have also heard people say, I started feeling sick, but I had just gotten the flu vaccine, so I thought my symptoms were related to the vaccine, or because of the recent fires, I thought my sore throat was related to the smoke in the air. In these times of uncertainty, and with the prevalence of COVID-19, if you have symptoms, the safest actions to take are to get tested and isolate until you know your COVID status. En estos tiempos de incertidumbre y con la prevalencia del COVID-19, si tienes síntomas, Las acciones más seguras de tomar son hacerse la prueba de COVID y aislarse hasta que sepa su estado de COVID. If you have symptoms, please quarantine away from everyone. This means stay in your room and do not go to work, wear a mask, go get tested, and remain isolated until you get your results. Maybe longer depending on the results. Si usted tiene síntomas, es importante aislarse de otra gente. Esto significa no presentarse a trabajar, mantenerse en su cuarto alejado de otras personas, mantenga el uso de su máscara, haga la prueba de COVID y manténgase aislado hasta recibir sus resultados. We are entering our flu season. Flu and cold symptoms can be similar to some of the presenting symptoms of COVID-19. Some helpful facts about the vaccine are: there is currently no vaccine to prevent the COVID-19 virus. Vaccines against pneumonia, such as the pneumococcal vaccine, don't provide protection against COVID-19. The flu shot won't protect against COVID-19 virus. However, annual flu vaccinations are recommended for everyone aged 6 months and older. Please make it a point to get your flu vaccine this year. You cannot tell the difference between COVID and the flu. If you have fevers, chills, and sweats, you could have COVID or you could have the flu. So one big reason why everyone should get the flu vaccine starting now is so that if you get the flu vaccine, then if you do get sick with these symptoms, at least you'll be reasonably sure it's not the flu. But the main reason you get the flu vaccine is to prevent severe illness and help to make sure that you don't die from pneumonia. La razón más importante por cual obtener una vacuna en contra de la gripe es para prevenir enfermedad grave y asegurarse no tener complicaciones relacionadas a neumonía, la más grave siendo muerte. There have been a lot of myths out there about COVID, and we are here to separate fact from fiction. This week's myth: the flu vaccine can give you the flu. The flu vaccine cannot give you the flu. When you get the flu vaccine, sometimes it can make you feel kind of achy or give you mild symptoms, but it does not give you the flu. The flu vaccine does not contain the whole virus or live virus that causes the flu. And most importantly, the side effects are worth it when it keeps you from getting pneumonia and dying from the flu. Bottom line for this week's Mythbuster: the flu vaccine cannot give you the flu, so please get your flu vaccine this year. La vacuna en contra de gripe no le puede causar gripe. Por favor, obtenga su vacuna en contra de gripe este año. If there's information out there that you want us to report on, you want to know if it's fact or fiction, submit your questions on Facebook, direct message us, or send us an email at admin@rootsclinic.org. Now, back to Dr. Noha for some final words.
Thanks for that, Anna. Now here's our best advice one more time. If you have symptoms, please get tested. If your children, your loved ones, others around you are getting symptoms, if they say, oh, I think my allergies might be acting up, or I think I'm catching a cold, those are good indicators that it's time to get a COVID-19 test just to be on the safe side. then we can stop the spread and get ahead of these high positivity rates that are impacting us, especially here in East Oakland. This virus is not letting up in East Oakland, let's be clear. So when you see the news talking about how rates are coming down in Alameda County, that's great. It doesn't apply to East Oakland, so please be vigilant. Also, please get a flu shot. This is an important time to get a flu shot so that we can be reasonably certain that if you do get those symptoms, it's not the flu, because otherwise, when you get tested, you'll need to get tested for COVID-19 and influenza A and B. So please get your flu shot. If you have symptoms, please get tested. And remember, mask up, space out. Thank you for joining us for the People's Health Briefing. Please tune in next Tuesday at 10 o'clock. And if you have questions, please put them in the comments or email us at admin@rootsclinic.org.